Hello everyone, I am Dr. Tejasvi Burchalla, consultant doctor in Fidicus Homeopathy. In our previous video, we discussed about what is recurrent miscarriages, its symptoms. In today's video, we will understand what are the causes and risk factors for these repeated pregnancy loss and the necessary investigations required to identify the underlying causes, and also how this repeated loss can impact on our future pregnancy. I can explain this clearly on the board. Let's move on to the board. Now, let us understand the causes and risk factors for these recurrent miscarriages. Usually, recurrent miscarriage is nothing but the loss of two or more consecutive pregnancies, usually within the span of 20 weeks. This we call it as recurrent miscarriage. For this, there are so many causes and risk factors. Among these, one is chromosomal defect. When there is any defect in the chromosomes of either mother or father, it can lead to recurrent miscarriages. And another one is structural or anatomical defects in the uterine cavity. Structural defects like any malformation in the development of the uterus or any anatomical defects like septate uterus, like any septum in the uterine cavity, or any fibroid growth, adhesion formation in the uterus, and also different shapes of the uterus like bicoordinate uterus, unicoordinate uterus, or didal face uterus. All these conditions can lead to these recurrent miscarriages. In these conditions, if even though implantation is possible, but the growth of the growing fetus may be difficult. So this difficulty, repeated miscarriages may be happen. Another one is hormonal imbalances. Usually, some hormones like progesterone is important in the continuation of the pregnancy. When there is imbalance in this progesterone hormone, it can lead to repeated miscarriages. Next one is immunological reaction. Usually, our immune system fails in this condition. We can recognize this pregnancy as a foreign body and try to destroy this pregnancy. So, this action, repeated pregnancy may be happen. And also some infections like any infections in the uterine cavity or any reproductive tract infections. All these infections can lead to the improper formation of the endometrium. Through this improper formation, implantation may not be happen properly and also causes repeated miscarriages. Along with this, some lifestyle factors like smoking, alcohol habit, caffeine intake, and also some improper diet maintaining. All these conditions can directly cause repeated miscarriages by disturbing the hormonal balances. Along with this, the major factor is age-related factor. Usually in women of more than 35 years of age, naturally the quality of egg may be reduced. When there is pregnancy happen in these ages, it can lead to repeated miscarriages due to improper or poor quality of the egg. So all these chromosomal defects, anatomical defects, hormonal imbalances, infections, and age-related factors can cause the repeated miscarriages. In this condition, early identification and proper treatment is essential. Now coming to the how this repeated miscarriage can impact our further pregnancy. Usually, repeated miscarriages will be happen within 20 weeks of gestation period due to some underlying causes. These repeated miscarriages can cause physical impact, emotional impact, and psychological distress. Physically, due to this repeated imbalance, physically it causes pain, recurrent pain, and also it weakens the uterine cavity. Endometrium formation may be impaired. Due to this impaired endometrium condition, it can lead to further miscarriage in the future. Your pregnancy will happen. And this repeated pregnancy loss also causes hormonal imbalances in the body. These hormonal imbalance further delays the menstrual cycle, ovulation time. All this can lead to difficulty in conceiving naturally. When there is any retention of these products like products of conception like any parts of the growing fetus in the uterine cavity, it can lead to infections and also scar formation in the uterine cavity. These scar formation and adhesion formation can disturb the further possible pregnancy. So physically it impairs the uterine cavity. So physically it impairs the capacity of the uterine cavity, hormonal imbalance, and also formation of scar tissue or adhesions in the uterine cavity. Not only physically, it also impacts emotionally. Emotionally, it causing huge impact. Due to these repeated losses, the woman may feel shy, guilty, and also decrease in confidence. These can lead to depression conditions in some women. So these repeated pregnancy loss can have huge impact emotionally. Not only physical and emotional, it also disturbs the relationship status between the partners and also causes family pressure. Due to this stress, further pregnancy may be difficult in conceiving future. These repeated losses can affect physically, emotionally, and psychologically. Now, coming to the necessary investigation to identify the repeated pregnancy loss. These repeated pregnancy loss having some underlying causes like fibroid growth, anatomical defects, improper formation of the endometrium. All these conditions can cause repeated pregnancy loss. These can be identified by 3D ultrasound. This is the first most test to identify the underlying cause. In this ultrasound scan, you can identify the structure of the uterine cavity or any formations or any extra growth in the uterine cavity should be identified by this ultrasound technique. Next one is HSG or hysteroscopy. This is the X-ray technique in which dye is inserted into the uterine cavity. Through this, you can identify the tubal patency and also the normal uterine cavity structure. Next one is hormonal profile. Hormonal profile should be done in this repeated miscarriage condition to identify the hormonal status of thyroid function, prolactin function, and also progesterone levels. Other one is blood test. Apart from this hormonal test, blood test may be done in these conditions. By this blood test, we can identify the sugar levels in the body and also any immune markers is there or not, or any infection markers are identified by doing this blood test. Next one is thrombophilia screening. This thrombophilia screening can be helps in detection of the any blood disorders or any improper circulation of the blood to the uterine cavity should be identified by this thrombophilia technique. Next one is along with this some semen analysis and also DNA fragmentation should be done in these recurrent miscarriages. By this semen analysis and DNA fragmentation, you can identify any DNA abnormalities in the semen should be identified. And also karyotyping is essential. Most of these recurrent miscarriages are mainly due to some chromosomal defects. So this karyotyping, you can identify the chromosomal defects easily by doing ultrasound, HSG technique, hormonal profile, blood test, and also semen analysis and DNA fragments. These underlying causes may be identified. Apart from this, some torch panel may be advised by the doctors. In this torch panel, infections should be identified like toxoplasma, any herpes infection, or any cytomegalovirus infection may be identified by doing this torch panel. So, in recurrent miscarriage conditions, proper investigation necessary to identify the underlying causes. If you are struggling with these recurrent miscarriages or pregnancy losses, Fidicus Homeopathy is the best option. What do you get from Fidicus Homeopathy means the success of case mainly depends on the three main steps. One is the treating doctor, second one is the drug device we are following, third one is the infrastructure we have. At Fidicus Homeopathy, doctors are with passion, qualification, knowledge, experience, competence, and compassion. The drug device we are following is our top quality medicine, and we are also best in segments. We are getting our medicines from best pharmaceutical industries, and we are also best in segment. The infrastructure we are using also is of latest technology and artificial intelligence. By using this latest technology and artificial intelligence treatment option, we can give better results to the patient. Now coming to the consultation part of Fidicus Homeopathy. Fidicus Homeopathy provides two types of consultation. One is online consultation. Second one is in-person consultation. In online consultation, audio and video call options are available. By using this option, you can share your reports to us. If any reports are necessary, we will let you know. You can get it back locally and send it back to us. After completing the case taken, the main treatment will be started. Once the treatment is started, we will ship your medicines to your doorstep wherever you are in the world. If you are staying in India, it will take 3 to 4 business working days. If you are staying other than India, it will take 3 to 8 business working days. If you want to consult Fidicus Homeopathy by in person, you can visit our nearest branch and get consultation. Now coming to how to consult Fidicus Homeopathy. This is our WhatsApp number 799971013013. By using this number, you can call or message to us and get consultation. If you have any doubts about Fidicus Homeopathy, this is our website www.fidicus.com. You can visit our website. By this website also you can get consultation. Why Fidicus Homeopathy only? There are so many corporate hospitals are there. So many homeopathic hospitals are there. Why Fidicus only means Fidicus Homeopathy stands for highest chance of health. And also Fidicus Homeopathy mainly follows three main principles. One is the highest success rate, second one is the transparent treatment, third one is the personal care. Regarding these repeated pregnancy loss and infertility issues, we are having highest success rate. And we are also providing transparent treatment. Transparent treatment in the sense we can explain the condition to the patient clearly and also prognosis to the patient. We are also providing personal care. Personal care in the sense we can give each and unique treatment to every patient and we also advise them to maintain a healthy and balanced life. All these are the advantages of selecting Fidicus Homeopathy. Now we discussed about the causes and risk factors for these recurrent miscarriages and also the necessary investigation to identify the underlying causes and also how this repeated pregnancy loss can impact on our future pregnancy. Remember, if you or someone you know is struggling with these recurrent miscarriages, remember Fidicus Homeopathy is here to help you with safe, effective and timely treatment. With early identification and right homeopathic treatment can give big results. Thanks for watching.